Topic number 16, Fundamentals of Malformation Surgery, lecture Shevchenko Alexander, Baltic Federal University Medical Institute, Kaliningrad 2020. So first of all, we must talk about malformations. What does it mean? Malformations, it's deviations of development of the body, organs or tissues in the prenatal period. So, malformations, abnormalities of development. The occurrence of abnormalities in the structure of organs or tissue systems with changes or exclusions of their functions as a result of violations of intrauterine development of the fetus. Abnormalities in the structure of organs occur in the prenatal period of development and are manifested immediately at birth. Much less often, abnormalities of development appear later, since the existing deviation in the structure of the organ with the growth of the child progress. Congenital malformations are not uncommon. According to WHO, they occur in 0.3–2% of those who are born. Teratogenic factors. Factors that contribute to the occurrence of fetal abnormalities can be divided into internal and external. The effect of teratogenic factors is manifested in the first weeks of pregnancy, especially from the 3rd to the 5th day, from the 3rd to the 6th week, periods of zygote implantation and organogenesis. So here you can see on the picture most common teratogenic factors such as alcohol, drugs, hormones, cigarette smoke, measles, so viruses, different viruses, not only measles, lead and mercury. Internal teratogenic factors include primary genetic defects, hematopaths, actually hereditary pathology, hematopathy due to gene mutations, chromosomal mutations. When a single gene is defective, monogenic abnormalities, polysyndactyly occur. Chromosomal and polygenic mutation lead to multiple malformations. Genetic defects are more often manifested in mixed-related marriages, in which abnormalities occur 4 to 5 times more often. External teratogenic factors include infections, the action of chemical and physical agents in 1 to 3 of cases of all defects caused by external factors. The cause could not be determined. Infectious teratogenic factors include diseases of the mother, especially viral nature, chickenpox, measles, herpes, viral hepatitis, poliomyelitis, and to a lesser extent microbial nature, scarlet fever, diphtheria, syphilis, etc., as well as some protozoal diseases, toxoplasmosis, listeriosis, cytomegalovirus, etc. Cytomegalovirus, it means cytomegalovirus. Cytomegalovirus is complication of this disease. Penetration of viruses and microbes through the placenta can lead to a disruption of the fetal development. Chemical teratogenic factors include toxic chemicals, pesticides, defoliants, insecticides, as well as drugs, sedatives, psychotropic drugs, some antibiotics, amidopyrin, etc. This group of drugs includes nicotine and alcohol. So any pregnant woman must not use, don't smoke or use alcohol, and so many drugs have contraindications to their use in the period of pregnancy. Physical factors of teratogenic action include mechanical injuries of a woman during pregnancy, vibration, ionizing radiation, overheating, hypothermia. Prophylaxis. Preventive measures based on the cause of congenital abnormalities are carried out in two ways. First, identification of genetic abnormalities in future parents, and second, elimination of external teratogenic factors on a woman, especially during pregnancy. Classification of birth defects. All observed birth defects can be divided in the following major signs: change in size, shape, and position of bodies, changes in the number of organs or lack of organ, the emergence of a new rudimentary organs, change of the size, excess development of a body part or organ, hypoplasia, incomplete development of the development of the organ, excess development, I made a mistake here, excess development of a body part of the organ named hyperplasia, and incomplete development of the called hypoplasia. So, excess development, hyperplasia, and the incomplete development is the hypoplasia. The complete lack of an organ is called aplasia or agenesis. Changing in the shape of organs, clubfoot, horseshoe kidney, two-horned uterus, etc. Anomalies in the location of organs, ectopia, heterotopia, cryptorchidism, aberrant thyroid, increase in the number of organs, polydactyly, hermaphroditism, additional ribs. Atavisms, median or lateral cyst of the neck, and fistulas. And duplicating anomalies, like congenital twins. Malformations of the skull and brain. In the first part of the lecture, we divide this lecture into two parts because it's so much material. So, hernia of the brain, cephalocelia. A herniated protrusion along the midline of the skull through a defect in the bones. Is rare, one case per 4,000–5,000 newborns. The defect in the bone is localized either in front at the level of the bridge of the nose or in the occipital region. The hole in the bones of the arch of the skull hernia gate has various shapes, has various size. A rounded shape with smooth edges, its diameter is much smaller than the size of the protrusion through the hole in the subcutaneous tissue. The meninges protrude, forming a hernial sac, the contents of which can be cerebrospinal fluid or brain tissue, and the presence of both brain tissue and fluid is possible. The size of the protrusion varies from a few centimeters to the size of a child's head. The formation of an elastic consistency when pressed may decrease due to the reduction of the contents. The movement of fluid inside the skull, which may be accompanied by convulsions, loss of consciousness, etc. The exact location and size of the defect in the bone is determined by an X-ray or MRI. The defect is combined with other abnormalities: dropsy of the brain, cleavage of the lip, soft and hard palate cleavage, etc. Most babies die soon after birth. Children are severely retarded in their mental development. Here we see this picture of a child with dropsy of the cranium. In this sac, hernial sac, part of the brain and fluid in the inlet collected. And on the right side, this is not the picture of the same one patient. This is a different person's On the right picture we see a small defect and a small hernia sac where only fluid collects. We didn't see the parts of the brain protrude out from this hole in the cranium. Treatment. Surgical removal of the hernial protrusion along with its contents and plastic closure of the bone defect. The brain matter, if it is the contents of a hernia, is so degenerated that its removal does not affect the function of the brain. The defect in the bone is caused by moving the periosteum along with the aponeurosis by the bone plate and for large bone defects. Hydrocephaly or hydrocephalia. Dropsy of the brain is associated with excessive formation and intracranial accumulation of cerebrospinal fluid. Fluid can accumulate between the membranes of the brain, external form of dropsy, and lead to compression of the brain from the outside, or accumulate in the ventricles of the brain, internal form of dropsy, and cause compression of the brain from the inside. Compression of the brain leads to its atrophy. The accumulation of fluid causes a sharp increase in the size of the head. The appearance of the skull is characteristic. Its arch prevails over the facial skull, the forehead overhangs the eye sockets. Children develop poorly, sharply lag behind in mental development. This is a typical picture of the hydrocephaly. And when we talk about accumulation of the cerebrospinal fluid, sometimes it accumulates between the membranes of the brain, and this is external form of the dropsy, and sometimes in the ventricles. So if we look at this picture, if this person had such disease and baby has collection into the ventricles, so we have distinction here. This part of the brain go outside, push it outside, and ventricles will be much more larger in this case. Craniostenosis is an abnormality in the development of the skull caused by a premature growth of fontanelles and sutures with the formation of calcification folds in the growth zones of the skull. The growing brain is compressed in a narrow skull, which leads to slow growth and atrophy with the development of microcephaly. It is characterized by a decrease in the size of the skull vault, the predominance of the facial skull over the vault. Children develop poorly mentally and physically. Psychically. Sorry. So on this picture we see craniostenosis. We see this part of the skull didn't develop in the right way. So treatment and early operation is strict indication. We must provide craniotomy, resection, and bone fragmentation of the cranial vault. In this example, we must cross the skull here. We must take this part of the skull and we must provide artificial parts from maybe titanium, for the right development of the brain and the skull, because if we live situation like this patient will be underdeveloped. Malformations of the spine and spinal cord. Spina bifida. Incomplete closure of the vertebral channel. This concept combines various types of spinal abnormalities in which a defect of the spinal channel is determined, through which the membranes of the spinal cord and its roots can protrude with the formation of a spinal hernia. We have different types of the spina bifida. Complete spina bifida. For a significant length, the most severe form, which is combined with other malformation. Children's are not viable. Partial splitting of the vertebral edges can be manifested by the formation of spinal hernias with the bulging of the meninges through the split spine. The contents of the hernia can be cerebrospinal fluid, spinal cord elements, or the horse's tail. So we have different types of the spina bifida. Spina bifida occulta, where the arches underdeveloped, and in this case it's very interesting, but very common hair growing in persons who have this pathology, hair growing in the projection of the defect. Most often it's lumbar region. So here we see on the picture B, spina bifida with meningocele. We see protrusion only meningeal, and on the next picture we see the parts of the brain, spinal cord go through this hole in the arches of the vertebra. And most severe case, spina bifida with myeloschisis. It means that we have underdeveloped arches, we have meningomyelocele, and meninges are broken down. Spinal hernias are characterized by the presence of protrusion, often in the lumbar region, round in shape, elastic consistency. The skin over the protrusion is thinned, often defined by a symptom of fluctuation. There may be a violation of the functions of the pelvis organs, a disorder of defecation, urination, impaired innervation of the lower extremities. To clarify the location of the cleavage, the extent of radiography is performed. Treatment of spinal hernia is surgical. The operation is performed in infancy. Splitting of the arcs without protruding the brain membranes often does not manifest itself. This pathology is characterized by increased hair growth, hypertrichosis, birthmarks, skin pigmentation, angiomas, and dermoids in the lumbar region. Sometimes hidden splitting is manifested by the development of the horse's foot, clubfoot, night incontinence, paralysis of the lower extremities. Treatment is symptomatic. What is the sign of fluctuation? Do you remember? When we see or palpate some tumor, we must touch it, and when we touch it, we must feel that it's soft, like our finger is collapsed some tumor with something sticky and viscous in it, and we must put our hand on the another side, and when we push we must feel that pushing from the right side go to the left side, or from the left side to the right side. This is a sign of fluctuation. Facial malformations. Cleft lip or haloschisis. Synonym: cleft lip, non-cleft lip, haloschisis. It is rare, one case per 2,500 newborns. The cleft can capture either the right border of the upper lip or the entire lip to the nose. Sometimes the gap penetrates into the nasal cavity. The cleft may be bilateral. The baby is disturbed by the process of sucking. It is fed with expressed milk. The operation consists in plastic closure of the defect by moving the flaps. Here we see the picture of the same kid with the cleft lip, and on the right we see result after operation. Cleft palate, palatoschisis or anaschisis. The prevalence is 1 case per 1,000 newborns. The reason for splitting is a violation of the fusion of the maxillary process with the culture. Services can be one side or two side. It is possible that only the hard palate is not joined. The latter can be combined with crevices of the soft palate. In this case, the oral cavity and the nasal cavity are reported. They conjugate. The child cannot suck. The milk flows into the nasal cavity. The child is fed with a spoon or from a drinking bowl. When a cleft palate is combined with a cleft lip, the process of sucking and breathing is abruptly disrupted. Here we see cleft palate. So we see the hole which connects the oral cavity with the nasal cavity. And macrostomia. Splitting of the corner of the mouth with one or both sides, excessive wide mouth slit. In this case, the child's nutrition is disrupted. There is constant salivation, irritation and inflammation of the skin. Treatment on the surgical, plastic removal of the defect. The operation is performed in infancy. So here we see macrostomia with defect of the side. It's not always left side, it can be on right side. Identified pictures with the macrostomia where we can see the really large mandibula, but this defect occurs very rare. Malformations of the necks. The most common is torcolis, a congenital fixed tilt and turn of the head to the side due to the shortening of the sternoclavicular mastoid muscle. Or abnormalities of the cervical vertebra. The typical position of the head allows you to make a diagnosis. To clarify the cause of the abnormality, radiography of the cervical spine is performed. Treatment. A slight degree of torculosis or torcolis at an early age is treated conservatively. The head is fixed with a tilt in the opposite direction. If conservative therapy is ineffective, in severe cases of torticollis, surgery is indicated. The insertion and extension of the tendon of the sternoclavicular mastoid muscle. It is better to operate at the age of 2 or 3 years due to trial of conservative treatment. Here we see the kid with torticollis. but on this age we can try conservative treatment. Additional cervical ribs. It causes shortening and deformity of the neck, change the position of the head, lead to compression of blood vessels and nerves. The diagnosis is made by X-ray examination. Treatment. If there is a violation of the neck function, compression of organs, an operation is used, the removal of additional ribs. It's not the best picture, but here and here you can see the additional ribs of the neck. Median cyst and neck fistulas are remnants of ductus thyroglossus, from which the isthmus of the thyroid gland develops in the embryonic period. Violation of embryonic development leads to the formation of a sized cyst or fistula. Cysts are located strictly along the middle line in the projection of the hyoid bone, where a dense elastic rounded formation is determined, soldered to the skin and underlying tissues, and is painless on palpation. When swallowing, the formation moves with the hyoid bone. When the cyst separates, a fistula is formed. The median fistula is palpated in the form of a dense string strictly along the middle line, going up to the level of the hyoid bone. The discharge of the fistula is serous purulent. When probing, you can pass the probe to the hyoid bone. Fistulography determines the position and direction of the fistula. Treatment. Surgical complete excision of the cyst and fistula. Here we see the suppurative cyst. If you touch it, you can feel sign of fluctuation. And here in the middle we see laceration with yellowish color, so it will be soon fistula. Lateral cysts and fistulas, as well as the median ones, are remnants of the thyroid pharyngeal duct. They are located between the larynx and the sternoclavicular muscle, go up towards the pharynx. Fistulography specifies the position, size, and direction of the fistula. Treatment: surgical excision of the cyst and fistula. Malformation of the chest and organs of the chest cavity. Congenital chest deformities. The funnel-shaped chest, thorax infundibulariformis, is characterized by the depression of the sternum and ribs with the formation of a funnel on the front surface of the chest. Keel-shaped thorax. The protrusion of the sternum along with the ribs, resembling a wedge, is determined. Deformities of the chest determine a cosmetic defect, but it is possible to move the mediastinal organs, which leads to functional disorders. Treatment: for small deformities, conservative massage, physical therapy; in severe cases, surgical correction. The intersection of the ribs, sternum, the formed mobile fragment of the chest wall is installed in the correct position and held with stitches and a special corset on with magnetic plates. Complete non-infection cleft of the sternum, fissura interna, is rare in combination with other defects. Heart disease, ectopy of the heart. Treatment: only surgical. Kyphosis is caused by spinal deformity. In addition to a cosmetic defect, there may be functional disorders, circulatory and respiratory disorders. Treatment: for functional disorders, surgery, plastic surgery on the spine, lung malformation occur in various variants. Most often they are associated with underdevelopment of the organs or its elements. Aplasia, agenesia of the lung is extremely rare. It is usually combined with esophageal atresia, diaphragmatic hernia. Vices are often incompatible with life. which are often incompatible with life. Treatment only symptomatic. So here we see the funnel, chest and keel-shaped. Malformations of the lungs. Hypoplasia of the lung is expressed in the underdevelopment of the bronchopulmonary structure of the lung. A special form of underdevelopment is polycystic lung. The defect is manifested by repeated pneumonia, bronchitis, sometimes chest congestion of the site of the lesion, shortening of the percussion sound, in radiography darkening of the pulmonary field or part of it, in bronchography cystic expansion of the bronchi. Treatment: surgical resection of the affected parts of the lung. Lobar congenital emphysema of the lung, emphysema pulmonum and syncytium labare. Malformation of the adductor bronchus and its branches, in which the portion of the lung is in an inflated state and does not subside when exhaled. The inflated lobes squeezes neighboring lobes and causes the mediastinum to shift to the healthy side. The disease is manifested by shortening of breath, hypoxia, when X-ray examination, increased transparency, respectively the inflated lobe and the displacement of the mediastinum. Treatment: surgical removal of the enlarged lobe. Here we see unilateral congenital lung hypoplasia. We have one normal lung and one underdeveloped lung. Lung cyst occurs as a result of impaired embryonic development of the respiratory apparatus, manifests itself in a complicated course. Cyst separation, rupture with the formation of a pneumothorax, compression of the neighboring lobes. Treatment: surgical resection of the lung tissue with a cyst, lobectomy, and pulmonary sequestration, sequestratio pulmonalis. Sequestration after interfilled. It is caused by additional blood supply to the section of the lung that is formed in isolation from the bronchial system. Through the aberrant artery that departs from the aorta, the separated portion of the lung is located inside the lobe, and it is impossible to separate it from the lung tissue. Danger of vice suppression of the sequestered area. Treatment: surgical lobectomy with mandatory ligation of the aberrant vessels. This is the end of the first part of the lecture. Thank you for your attention. Tomorrow we see the second part of the lecture. Goodbye.